Hi, my name is Laura Salinas. I'm a student at Nightingale College. I'm a BSN 266. I'm in section number 5. Today I will be performing or demonstrating an IV fluid administration followed by IV piggyback medication administration using gravity tubing. Before I begin, I'm going to perform hand hygiene. I'm going to be donning on clean gloves and gather all my supplies. My supplies include an IV tubing with a needleless Y site secondary IV tubing bag and a primary IV fluid, which I have my IV fluid here. I have my amoxicillin here. I have my alcohol swabs. I have my IV port. These are the needle-free Y site tubing that I was talking about. I have two, one for the fluid, one for the medication. They both have 15 drops per ml. And on the second bag, 15 drops per ml. These are tampered with because of how many times I've been doing these videos, but normally you would make sure that they're not tampered with before even grabbing these. Before preparing the IV, I verified with the provider's order using the patient's medication administration record, the MAR. I also verify the 6 rights of medication, medication administration, the right patient, the right medication, the right dose, the right time, the right route, and the right documentation. Next, I will need to look at the patient's chart and make sure that there's no allergies to medication. I will also ask the patient if there's any medication allergies, especially to amoxicillin. The patient will say there's no known drug allergies for this demonstration. And then now I will go over my calculation, which for the fluid, the provider ordered 150 mLs over 60 minutes times 15 drops per ml, equaling to 37.5. If we round it out, that's 38 drops per minute. That top part is the first order. And for each order, I want to clarify, you have to verify the 6 rights of medication for both for each. So that's twice, at least you'll be verifying, but more than that, of course. For amoxicillin, for the second medication, it was ordered amoxicillin 250 milligrams in 100 milliliters of normal saline to infuse over 15 minutes. And for that dosage calculation is 100 ml over 15 minutes times 15 drops per ml, equaling to 100 drops per minute. Now we're going to go ahead and demonstrate what we're going to do. So this is the main port, the main line, I should say. See, I already touched that. So this is my spike. This is sterile. That's why there's a cap on there, because this is going to puncture our bag of our medication and our fluids. So that needs to be sterile at all times. We don't want to touch it. We don't want to uncap it until we're ready. This is our chamber to where when we squeeze it, we will fill it up halfway. This is where we can monitor the drips. This is our rolling clamp to where we can adjust how fast we want it to go, and also to prime our tube, which we will be doing. This is the Y site, which literally it looks like a Y. This is where you'll have the second tubing, which is this one, will be where the medication is, because the first one will be, the main line will be the fluid. The medication, the second bag, and the second tubing will go here. And of course, we would sanitize before we would connect. And this would be our main port that goes straight into the IV access, IV port. Before we even begin, of course, we verified patient privacy, hand hygiene, identify the patient, at least 2 identifiers. Again, we will go over the 6 rights of the medication administration. They verified they're not allergic to any medication, especially amoxicillin. So we're going to go ahead and start this demonstration. I do have a cup here just to collect the fluid as we start priming our bag. So we want to make sure that we're keeping these sites sterile. So I don't want to puncture. I don't want to open anything or use anything until I'm ready to go, which now I'm ready. I'm going to go ahead and spike this bag, which means it's just going to go straight in there. We can twist a little bit to make it easier, which this one is a little easier because I've been using it. I'm going to go ahead and hang it up before I prime it. We're gonna go ahead and squeeze it, that chamber, just to where it's about 15, halfway, I mean. There we go, that's about halfway. So now we're gonna go ahead and start priming our tubing before we calculate our drip rate. So I'm gonna go ahead and use the roller clamp. I'm gonna go ahead and unroll that up to go ahead and prime this. There we go. I'm sorry, you can't see. Okay, let's stop. We got you primed. Okay, so now that we have that primed, we're gonna go ahead and monitor our drip rate. Let's make sure we set that. And we're gonna be calculating that for a full minute, okay? So I'm gonna go ahead and put this off to the side for just, if I can make sure that it's not full. Okay. We're gonna go ahead and start now. Now that we verified that that was 38 drops for that full minute, we are now going to connect. And before we connect, we will go ahead and wipe this with alcohol swab. And we would let it dry before we connect. It's dry, we would go ahead and connect. And so now, I'm gonna leave that off to the side. We're gonna go ahead and set our second back, our second line. Same thing, we have our spike, we have our chamber, we have our rolling clamp, and then now we have our port access. You do want to make sure that each extension is compatible with each other. So I want to make sure that my medication one, the tubing, is compatible with my fluid one, which they are. I pre-checked. We're going to go ahead, everything, there's caps on everything, so we're going to go ahead and get this going. They're sterile. Again, you do not want to do anything. Before we connect our patient, we always want to look at the IV site to make sure that it's okay. No redness, no infiltration, no swelling, no bruising, that it's intact before we ever hook them up, which we did. That's already getting loose. Oh, it's already going. I should have made sure that was clamped beforehand. That's why we always double check. So this does need to be 30 inches above the primary line. So we're gonna go ahead and do it further up. We're gonna go ahead and squeeze our chamber to where it's halfway. I can still see my drips. We're gonna go ahead and prime our line. Very good. And so now I'm actually going to want to calculate this. And this one has to be 100 drops per minute. So we're going to be verifying the full minute with this one as well. This one has to go a little faster. Okay, we're going to go ahead and start verifying that now. Okay, that's a full minute. And so now we would want to connect, and we would want to make sure we unscrewed this. We're going to get our other clean alcohol swab to swab the white port, and we're going to go ahead and connect. And I'm gonna screw this over here. And we will connect. So they're already connected. We already verified that the 38 drops per minute and the 38 drops per minute for the fluid, and then the 100 drops per minute for the amoxicillin. We are going to, because of the medication, we have to wait about 15 to 20 minutes to make sure that the patient does not have any allergic reaction. And I don't know if you can tell that this one's hung up higher than the other one, 30 inches above the main line, the medication. So we would stay to make sure that there's no allergic reaction. We'll make sure that the patient is aligned in a comfortable position, give them their call light. And we would check and monitor the IV site to make sure, again, there's no swelling, no redness, the IV site's intact, there's no bulging, there's no infiltration. She's not having any reaction. We will clean up our supplies. We will perform hand hygiene. And we would document what we did. Thank you.